You're listening to RazorCast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.
Hello, everyone. This is Liz Harvey coming to you from our studios in New York City, where we are dedicated to bringing you cutting-edge interviews from many of the leading industry professionals across the U.S. In today's episode, we are speaking with Stephanie Heintzeler. Stephanie is a German-educated midwife, a U.S.-educated doula, an acupuncturist, and she is a certified lactation counselor. She is known as the New York Doula. Stephanie has delivered over 1,200 babies and has experience with twins, triplets, breech babies, and water births. She also works with newborn patients in their postpartum stage and holds classes and seminars for moms and dads-to-be. With a wealth of experience and knowledge in her field, Stephanie Heintzeler is widely considered to be one of the top doulas in the country. She is also a contributing member of our national network of industry professionals. Today we're going to talk about a very important topic, anxiety during pregnancy. Hello, Stephanie. How are you today?
I'm good. Thank you. How are you?
I'm doing great. Thanks so much for being here. So,
thanks for having me.
What effects does anxiety have on the pregnant mother's body?
Depending on how, the anxiety plays out, if it's affecting her lifestyle or if it's affecting, her sleep, or just general, overall anxiety during the pregnancy, it can cause a low birth weight or premature birth if it, really affects the body. But mainly stress and anxiety causes just a non-happy pregnancy. So mothers who are very, very anxious throughout their pregnancy, they usually don't have a good experience. So they go in labor, already being stressed out, already being maybe in pain, they couldn't sleep, they're tired, they have back pain. I mean, all the tension in the body really, really reflects on the birth and, of course, postpartum. So we do have a higher rate of postpartum depression after the birth. We know that moms who have had depression before pregnancy or during pregnancy, they also have a hugely increased risk of postpartum depression. So working with a doula can really help lower that risk, and of course working closely with the OB or midwife to make sure, if necessary, to take medication.
And what are the main causes of anxiety in pregnant women?
It's several things. It depends, again, on whether the mother had anxiety before the pregnancy, meaning depression or panic attacks or general anxiety. So then we need to look at what caused it before the pregnancy. Pregnancy itself causes a lot of anxiety because there's so much changing. I mean, it's just crazy how the body changes. Like, you don't even feel your own self anymore. Maybe you notice or your doctor says something about the pregnancy, the baby isn't growing properly, or the little things sometimes can cause a tremendous amount of anxiety. Nowadays we have Zika that in New York, being in the U.S. Causes anxiety. But we really need to look at, is it anxiety that is related to something? Is it general anxiety? Is it anxiety looking at the birth? Is it anxiety about all the changes? What I can say is that many parents don't understand that the pregnancy itself is a huge change. But then they also think they need to get married or even need to move throughout pregnancy or both, which is like, and then they call 2 months before their due date and they're completely exhausted and they're completely out of place because they moved and they got married and everything happened in 1 month and they know they're going to have a baby. So they're completely lost. And I can only strongly recommend to try to avoid getting married, as beautiful as it is to get married before the baby is born, but it's just so stressful. And also moving. Moving is really, yes, it's nice to have a bigger place, but the baby doesn't care. The baby doesn't care where you live. It's really more important that you have a healthy pregnancy and keep that stable, keep the relationship, just focus on the pregnancy as a couple. And then after the birth, you can focus on everything else when you're actually able to, give your baby to your mother or just at least feel like you have your own self back.
Well, that's great advice for sure. So how can hiring a doula help to alleviate anxiety during pregnancy?
So the doula is a person who stays throughout pregnancy. So usually we get hired very early, like now it's November, and I now get inquiries for June. And so we get to know each other throughout pregnancy. So the mother has like a personal birth coach, like an expert next to her throughout the pregnancy. The partner has someone he can call, depending on the questions and, of course, changes in life. The doula knows the mother and really knows what kind of birth she wants, what's important for her throughout pregnancy. So it's just kind of keeping her sane and keeping her healthy and happy. Little questions can be answered, like little in terms of they end up being very big, but nutrition is very important, how to prepare for the baby. Usually I send out emails regularly just reminding of, this is when you should get your stroller and this is where you should look into childbirth classes because otherwise they're booked. And do you have a car seat? And did you pick your pediatrician? So literally like a wedding planner. The doula is like the birth planner, but also for postpartum, which of course is a much longer phase. And doulas also see throughout the birth if the mom panics. So in early labor, we stay in touch. We're on the phone oftentimes. Then I'm in the home. As soon as the mother, is not feeling well, I had a mom in the tub a few weeks ago, and she was just sitting there, and then she suddenly said, oh God, I'm not feeling well. I'm not well. And the dad, I could see him getting pale, right? He was like, oh my God, here's my wife, and she's in the tub, and she's not well. But she looked fine. She just noticed a stronger contraction, and she didn't know how to breathe through it. So we breathed through the contraction. And then in between, we talked, like, how it changed and where she felt it. And then the next one, again, we took the same breathing technique, and then she was fine. So it's really about catching the second the mom isn't well and bringing her back to a technique that works for her with the breath, and also positioning. And also if the doctor says something like, let's break your water, that sounds scary, and it's something that is an intervention, but usually there's a reason why the doctor would like to do it. So it's really someone who can help, like making the connection between the OB and the mother so that she feels there's someone who's kind of on her side and maybe advocates a little bit for her, but generally who knows her. I know my mothers, and that helps tremendously to have this bond.
And what are some helpful tips to naturally alleviate feelings of anxiousness? As esoteric as this sounds, but meditation is really the best thing a pregnant mom can do. It calms down the mind. You learn about the breath. So that's something you can do everywhere and all the time, no matter where you are. And you could do it 10 minutes a day. So it really saves a lot of time, too, and it's super effective. And then everything else that has to do with exercise. So yoga, running, anything, consistency where you don't exhaust yourself too much. And then talking things through with the doula. So, see what anxiety you have. Breathing exercises can help, talking with the obstetrician or the midwife. And really see how, what is it that affects, what is it that causes the anxiety? Is it the body changes? Is it just generally just the thought of having a child? Is it the birth? So kind of narrowing it down. Some moms don't know, but once we speak, we can narrow it down. And it's actually just pointing to one thing, having the baby, breastfeeding, the birth, things like that. It's usually not everything. And once we narrowed it down, that helps tremendously because we know it's just one or two things, and then we can work on those and alleviate the anxiety. All right. Well, thank you so much, Stephanie. We know you're extremely busy, so I just want to thank you for your time and help today.
Thanks for having me.
And for our listeners across the country, if you are interested in speaking with Stephanie Heintzeler, please visit www.thenewyorkdoula.com or call 917-399-2031 to schedule an appointment. On behalf of our entire team, we want to thank you for listening, and we look forward to bringing you more top-quality content from our country's leading industry professionals.
You've been listening to RazorCast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.